having something at night right now, but I had a wonderful day, and I am honored to have my cousin Amanda, who is an OT. With for those of you that don't know what it is, please stay tuned and learn what it is. If you are new here, please hit the subscribe button down here. We are 12 away from 500. And yeah, and please comment with any more questions or video we have, and like this video if you like it. Do you want to introduce yourself?
Yes, hi, my name is Alyssa Reeves. I am Anna's cousin, proud to be, and I'm an occupational therapist, and Anna invited me to just give you guys a little bit of an insight into what OT is and more questions to follow, but I'm really excited to be here and tell you guys what I love to do every day.
We're happy to have you. So, Miss Gordon, I know you are an occupational therapist. Can you explain what that means as far as what occupational therapy is and what you do for work?
Yeah, so I like to describe occupational therapy by kind of using the term itself. So we get occupational therapy by saying what occupies your time throughout your day. So our job as occupational therapists is to help you, whether you have an acquired illness or a disability or anything like that, anything that stops you or from achieving what you want to do throughout your day and what's important or meaningful to you. We want to help you get back to that by kind of focusing rehab on what your desires are and what is important to you. So with that, I am actually an acute care occupational therapist. So I work in the hospital setting. So a lot of the people that I see come in with, sometimes it's a chronic, disease that they come in for, but oftentimes too, it's something new that's happened to them. And so we're kind of the first ones to see them and help them navigate any new challenges that they have and help them get back to their home environment safely and make sure that they can get back to what's meaningful to them, whatever brought them to the hospital. So that is what I do.
Definitely. And I know for those of you who are new to me, I have cerebral palsy, specifically have the hard provisional cerebral palsy, which means all of my hormones are affected. So when I was younger, I don't do it so much now because they're actually a bit older now and not so much intensity therapy happening in your life. But when I was younger, I did OT, PT, therapy, and other therapy to help me have the best quality in life. So now, because of that, as many of you may know, I do a lot of art. I draw a ton, and sometimes I post about it, and I could only imagine if I didn't have OT, could I have done that? I have no idea, but that just kind of gives you an idea of what OT has done for someone with cerebral palsy, specifically me. Okay, can you tell us your journey and inspiration when it comes to becoming a occupational therapist?
Yeah, absolutely. So I was an athlete growing up, playing soccer, playing all the sports, volleyball, running, doing everything. And I was really interested. Sorry if you hear my dog. She's in the background.
Hi, Beth.
Hi, Jasmine. I was really interested in being maybe a physical therapist. So I had shadowed some physical therapists, and next to them were occupational therapists, and I had never heard of what occupational therapy was before. So that sparked my interest in it. And actually too, and I don't know if I told you this, there was actually one time when I was applying to OT school, they asked me to write an essay about kind of what inspired me. And you kind of came up as one of my kind of big inspirations, because I think one of the most important things is being exposed as a younger child to someone that does have a disability. Not everyone has that chance or that opportunity or is around anyone like that. And so I was really intrigued by being able to, to know you and to kind of see kind of what your life has been and stuff like that. And so when I wanted to become an occupational therapist, I always had you in my mind as, wow, okay, so what can we do to help people, and what can we do to help people achieve their dreams and what's important to them? And as I kind of looked at PT and OT, I kind of realized I think OT just felt more comfortable to me, and it felt a little bit more personal in terms of just being able to get down to what someone really wants to do and is meaningful. And so I kind of went towards that way instead of PT, actually, even though I do love physical therapy too. But yeah, so that's kind of what piqued my interest when I was younger. And then fostering that interest with sports and activity and exercise, and knowing I want to work in movement sciences and I want to be able to learn more about that. So a little bit of movement science and my interest in that, and then also a little bit of just growing up and being surrounded and intrigued and knowing people with disabilities, I think really helped me spark my interest in that. Yeah.
Definitely. It's really important that you are a disability at a young age. And a couple months ago, I did an interview with a mom hired with muscular dystrophy, and she talked about uploading your child with the ability to understand disability, and that I believe that's where my channel comes in. So if you're a parent out there, please share this if you have young children or whatever. But also, I did not know I was part of this inspiration, so that's kind of fun to know, because when I do go down to Texas, we do go out with mature often. So maybe next time I go down there, if you might want a baby Vaughn, maybe we will make that a reality. We'll have to see.
A day of life with the cousins.
Yes, that was. I can imagine taking Betty taking him.
Oh man. We'll see about that.
What if, is a common thing I hear on Instagram and everywhere. Everyone is always asking, not me, but other disability influencers that I follow, what the difference is between OT and PT. So my next question is, what is the difference between occupational therapy and physical therapy? For those who might not know or be confused about the difference between the two.
I think one good thing to note is OT and PT often work closely together, but we do have really distinct professions and distinct ways of looking at rehabilitation. Physical therapist is typically the most commonly known, and I think the most easy way to look at it is physical therapists kind of look at the what, and focus on mobility. So kind of what is missing, what are, what muscles are weaker, what's impacting that. And OTs, I think, focus a little bit more on the why. Why is this, why are you having difficulty with this? Why is this important to you? Why do you want to get back to this? And kind of seeing, okay, well, what is stopping you from being able to do that? And how can we either help rehabilitate? How can we come up with different ideas and strategies to adapt to what's going on? So I think OT takes a little bit of a holistic approach and seeing all of the components in terms of like if your emotional well-being is impacting how you're able to function throughout your day, if there certain behaviors you have, like stop you from being able to get through your day. If it's an environmental problem, if the things around you just aren't supportive to you and set up for the way that you need them to be set up. We kind of look at all of those holistic components and how that can impact your function and your mobility. So I think I kind of like to say, like, PT focuses a lot more on the mobility itself. And we focus on, okay, why do we need that mobility for you to be able to purposefully go throughout your day? What are we trying to get back to doing? What's important to you? So I say OT focuses on those daily activities that are meaningful and uses that to drive the rehab process. So I think it's a little bit more focused on that patient's specific request or specific joy in life, specific role, and how to get back to that. So that's I think the main difference between PT and OT.
Yeah, interesting. I myself, and I went through it almost 20 years and 27 days, 20, but I went through it, and I didn't even know that.
Well, and I'm sorry that you didn't get that from your OT, or if you didn't, they didn't get that a good explanation or that stuff.
I never asked for it.
That's okay. I think OT as well has just specific training and education in upper extremity rehabilitation too, and hands as well. So I think, working with you growing up, I'm sure handwriting was a big thing that maybe they focused on when you're talking about drawing. So I think oftentimes, especially in the schools and in education, OTs do have a specific focus on that, because it does directly impact sometimes how you're able to participate in class and get your assignments done.
Yeah.
So that why is in order to achieve, in order to be there in class and be present and be able to participate in that. And sometimes it's okay, maybe if the handwriting isn't legible and it's, or maybe it's too time consuming. Okay, well, let's adapt, and use the computer instead, or think of like that. Yeah. So I think sometimes in schools, that's a big focus, just because it directly impacts sometimes how you're able to participate in school.
Right. I remember, I don't think that I had OT outside of school, so we worked on the OT that I did have. We worked on like writing and cutting and building my ability to use the laptop, and I remember that was what we mainly focused on.
Mm-hmm. Yeah.
So, and now I'm kind of, and then I'm got older, I took mainstream art classes, so I learned, and my art teacher taught me how to draw, so now I'm doing it.
That's awesome.
Every day I have 8 drawing notebooks filled with drawings now.
And leisure, we say, is an occupation in itself as well. So things that you enjoy, even if it's maybe not directly related to work or school or anything like that, that's also an aspect of OT too, because it's an occupation. It's whatever occupies your time that's meaningful to you. So if drawing is meaningful, that's an awesome occupation.
My next question is, what are some of the benefits of OT for the younger disabled generation who have cerebral palsy or whatever disability than the older generation?
Some awesome benefits of OT for a younger population, I think, using cerebral palsy as an example, is cerebral palsy is often, something that you have from birth. So what is awesome about our brains is, we're constantly developing until possibly kind of like our mid-20s. So our brain is constantly learning and able to generate new ideas and new things at an early age. And so if you go into occupational therapy early, and we call it like early intervention, where it's for young kids all the way under 2 years old sometimes, the earlier you can seek occupational therapy services, the more we can kind of facilitate that learning for your brain and being able to get as much benefit from, you know, your muscles and how you're able to move and how you're able to kind of create new learning patterns and all that stuff. The younger you can get therapy services, the kind of more chance you have to be able to kind of facilitate how your brain develops. I work in an older population, so it's a little bit different, but at an older population, you know, especially age 65 and up, there's lots and lots of medical complications you can have just from age. And so oftentimes, you know, you're used to your job and your life roles, you know, whether you're a mom or a dad or a grandparent, and, you know, you have lots of life interests, like say you're an artist, and something happens to you, like you have a stroke or anything like that. Yes, you're older and, you know, your brain isn't quite as plastic as, we call it neuroplasticity. Your brain isn't quite as plastic as you were when you were younger, but now that this has changed the way you're able to perform, how can we come in and help rehabilitate, help create those new pathways again to help your brain heal, and help you get that function back? Or how can we change the way you draw, or change, you know, how can we adapt to what now might be your new normal, and what you might have for the rest of your life if it's, unfortunately, if we can't rehab all the way to get back to what you were doing, how can we adapt and change that? So OT is super beneficial kind of across the lifespan, we say, just because either way, whether you're adapting or you're learning new things or you're, you know, you have your goals, OT can work with you exactly where you are in that process and in your rehab process to make sure that your interests and what's meaningful to you, it doesn't get lost, so that you continue to know that your life has purpose and that you can, you know, you don't have to push your dreams on, you know, on the back table because you feel like you can't do it. There's almost always typically a way, whether we're rehabilitating or we're adapting and trying to find a different way to do it. So it's beneficial across the lifespan, which is awesome.
Yeah, I definitely agree with her. I'm always, even without an OT now, I'm always adapting my life and my activity that I do, because there is a woman Facebook group for adaptive women that I'm involved in, and we always share ideas on how we can adapt things. Right before this interview, I actually did an Instagram story about what I'm wearing tonight, because I'm actually wearing really, really big pants. Like, really, Mom said I look like MC Hammer. And I did an Instagram story about it, because no pants that I can actually bent down and up in the restroom by myself. So I put that on my Instagram for anybody who wants to see. But you're even adapting when you don't have an OT is important, because you can adapt anything in life. I have noticed.
That's awesome.
I mean,
and that you know you're doing that for yourself as well. You're like, okay, I can do this if I wear this certain type of pants, and that's how I can do it. And I think that's awesome. And I think being a part of, you know, your platform and everything like that is so motivating too, to know that, yeah, I can do this too, and this is awesome. And there's, you know, there's all different types of ways you can approach certain different things and adapt your environment and adapt what you need to do.
Yeah, absolutely. And the early intervention thing also applies to so many different aspects of the child life, because my brother, who you may have met, I don't know, I don't remember if he's been on here, Matt is a preschool teacher, and he always talks about how the early intervention in multiple ways can help as well. And when you get older, I can only, well, we all know our mama and our grandparents how hard make the net. So I can only imagine the elderly places that come in needing help, and you probably make their day when they figure out how to do something about.
I think in the hospital, one of the most common goals patients have, and it's just like, I want to be able to use the bathroom in private on my own. It's I think one of the things that they're most motivated by sometimes.
Well, why not? I mean, I would too if I were them.
Yeah, using the bathroom is an occupation as well. Everyone does it. Everyone's got to do it.
Let's see. Do you have an occupational therapy story when OT helped improve the higher life?
This question is really interesting to me. I was just thinking of one that I actually, a patient that I actually worked with recently in the hospital, and she had a stroke that affected her right side. So she had difficulty using her right arm and her hand and her leg, and her speech was also slurred as well. But she told me that she's from Mexico, and the way she earns her living is by making tamales over the holidays. And so she was really worried because she was like, I can't make tamales anymore. And, I don't know how I'm going to make money. And, my husband is still in Mexico. I don't know what to do. She was in the hospital for a long time because sometimes patients that don't have insurance don't have access to a rehab facility. So sometimes the hospital is the rehab that they're going to get. So I was able to work with her for a few weeks actually. And by the end of those few weeks before she discharged, we were practicing. Obviously, we didn't have tamales in the room, or the elements of it, but we were practicing. Like, she was like, okay, I put the masa on the corn, and she actually was able, like, with her right hand, be able to kind of go through those motions and get back to like practicing making tamales. And so with the help of PT as well, she was able to walk with a kind of a half walker, hemi walker, and she was able to kind of go through the motions of her day, and she was able to, to get through all of her daily activities. And she was so happy. And so every time I would come in the room, she'd be like, I've been practicing making my tamales, just kind of just in the air, like pretending. And she was just so grateful and so happy. And she felt more confident going home, being able to, work for herself, to provide for herself again. And so that was probably the most recent one I thought was really fun, because we don't always get to see that huge progress in the hospital because they often discharge pretty quickly. So,
and then it takes a while. It doesn't happen overnight. I know that. Because I actually made a video about how, and it's coming out, well, it's already out by the time you see this video. But it came out a week ago about how I went on and off the floor by myself and it back up to my desk chair because I was trying to demonstrate how someone with cerebral palsy could get off the floor in case they were home alone or hell or whatever it may be. And it took me like 2 tries to film that video.
yeah.
I realized that, well, I recently got a new desk out in my main area of my apartment. And I realized that desk was higher than the one I used to have.
Ah.
So I was, and I'm like 4'8". I'm tiny, and so I was having trouble leveling myself up to the standing position that I used to be able to. So I had to move to my bedroom where the other desk was. So it definitely takes time to adapt. So it won't happen overnight. Trust me, it will not.
And sometimes we work on floor transfers with patients. Okay, get down on the floor. How do you get up? Because, sometimes that's a big thing that, if you go home alone, if that happens, you could get stuck if you can't get to your phone or, call for help or anything like that. So yeah, that's really fun. That's awesome.
And calling for help too, while we're on that topic, is I have an adjuster in my main area and my bedroom area that I can ask to it for dad or for mom whenever I need to. So if you're looking for a way to call for help and you have lost your phone or can't get to it, I would highly recommend the Amazon Echo devices. They're wonderful. I have a post about that on my Instagram as well.
And so cheaper than life alerts if your family member can remember to know what to ask Alexa.
Right. And it's probably nice for it doesn't look as ugly as a either, because wearing the thing around your neck could hinder your muscles. I know most old people like to look nice. I know all members love to dress up. I mean, that's what she does.
It might not always match their outfit.
Yeah, so it might be a better option for your family if you can. And my last question is, what's your biggest advice for family thinking about enrolling or have a loved one in occupational therapy?
For starters, OT is not direct access, which means you do have to ask your provider for a referral. So my biggest advice would be to start with your doctor and ask them if they would recommend OT. And if you have any concerns or questions and you're just not sure, I think the most important thing to do is just to go for that evaluation and that referral. And I think sometimes the OT can kind of help guide you in your decision making and saying, oh, you know what, yeah, I think you came to the right place, or you know what, I think everything's okay. And I think the most important thing is that referral can maybe answer a lot of your questions. So if there's anything, I guess recommend consider what's important to you and what you want to get back to doing, or what you want your daughter or your son or your loved one to get back to doing. And if they're having difficulty with that, seeking occupational therapy could be a really good option. And hopefully your provider can help guide that process as well, and finding a good match for you.
Definitely. Hello everyone, thank you so much for watching this video and taking the time to make it the whole video. If you like this, thumbs up over here, and please share it with somebody, because sharing really helps me grow my platform, and plus it edits the word.